Good evening. It is 8:30 p.m. on Thursday, March 19th, and we are on day 2 of Sonoma County's shelter in place. As of today, we have 9 active cases of coronavirus and positive tests in Sonoma County, and we've had 196 tests administered. I think the thing that is top of everybody's mind this evening is the recent late-breaking news from the state of California. Governor Newsom just issued an order for shelter in place statewide, and actually I've already received a text from our county council top attorney in the county, Bruce Goldstein, letting me know that he is actually actively working on determining exactly what the nuances are of the new order, so that hopefully by tomorrow we will be able to share some information about what that statewide executive order means and how it might be different from the order that we are already under here in Sonoma County. So obviously we will be abiding by the state order, and we want to make sure that we're able to translate the nuances of that order into real information so that our businesses, our employers, our employees, and our residents know exactly what they are supposed to be doing for the next few weeks. So I've got a few actually pieces of good news tonight to share on a local level. I know that we're all looking for some good news. Number one, I want to give a huge shout out to Keysight. Keysight is actually donating a stash of PPE or personal protective equipment, and they plan to deliver it to the EOC or Emergency Operations Center at the County of Sonoma tomorrow. So I want to give a huge thank you to Keysight, a local company that is actually stepping up to help keep us all safe and make sure that we have some critical medical supplies and PPE. So also some good news from the state of California. Next week we are expecting additional PPE, personal protective equipment, specifically for homeless service providers. And this is something that we have been working very hard on in our Emergency Operations Center, and I'll provide you a little more information on that later. I wanted to let you know that on Tuesday, the Board of Supervisors is actually going to be considering an urgency eviction ordinance. This is to sort of give a little bit of detail. This is all I've got. I haven't seen even the draft ordinance of this yet, but it will essentially mean that if there is non-payment of rent due to COVID-19, that will be able to be used as an affirmative defense to an eviction proceeding. So in other words, you can use that as a defense to prevent being evicted if you cannot pay your rent because of the coronavirus epidemic. So that is something that we will be presenting and voting on next Tuesday at the Board of Supervisors. I wanted to let you know that we do have a coronavirus hotline in the county, and specifically it's available for small businesses. So if small businesses are trying to figure out, does the new order from the state actually apply to me or not, you can call this phone number. But you might want to wait until we figure it out because we just got that order in from the state. So the phone number is 565-4667, and then you can press 2. It's for small businesses. I also wanted to give you some updates on various ways that you can get information throughout the duration of the coronavirus epidemic. We have some brand new elements to our website up on the county's socoemergency.org website. Number one is a dashboard. You can actually see in GIS a map that has all of the different sort of numbers of cases, including recovered, active, all of the information that you could possibly want right there. And so if you go to socoemergency.org, click on Story Map, and that will take you straight to the GIS dashboard. I also wanted to mention that also on socoemergency.org, we have new information for vulnerable populations, and in particular our senior members of our community. If you click on resources, vulnerable populations, it will take you to a web page that has all of the new senior hours at the local grocery stores listed, so you know when seniors are able to go in early to which grocery stores in order to avoid sort of larger crowds and to keep them as safe as possible. I also want to tell you a little bit about what's happening inside of our Emergency Operations Center. Now, I am not in there on a daily basis, but I do receive daily briefings from our Emergency Operations Center chief. And what they're working on a lot of contingency planning right now for our unsheltered population. We're trying to figure out how we can, first of all, ensure that our homeless shelters are safe, which means actually creating safe distance, and which unfortunately is going to reduce the capacity of our homeless shelters. So as we reduce the capacity of our homeless shelters in order to keep people safe, we're looking at how we can increase capacity elsewhere. So we're going to be putting to work those 10 trailers, getting those out maybe at regional parks, maybe at the fairgrounds. We're sort of looking for where the best location is so that those can be utilized for shelter for our unsheltered. And we are also working on standing up, potentially leasing motel rooms to see if we can also get people off the streets and safely into motel rooms. There is also work being done inside the Emergency Operations Center regarding trying to create surge capacity in our healthcare system. So we have the county staff working very closely with all of the heads of our major medical and hospital CEOs in the county to talk about what is their capacity in terms of beds, and what might it take in order to create surge capacity in case we do see that increase in patients and the increased demand for ICU beds, respirators, that kind of thing. So I do want you to know that those conversations are ongoing. One of the challenges with our healthcare system right now across the country is that it's very fragmented, right? So we have different healthcare providers all adding up to a complete system of care in the county. And so we're trying to work with all of those different providers, right, to get them working together and thinking regionally, not just about one hospital, because at the end of the day, we are all in this together and we need to make sure that we have capacity across the system. So those are my brief updates for the day, and at this point I would love to answer any questions that you might have. So I'm going to see what has come in. Maybe Emmett can tell me. I'm seeing some questions flash by.
First, quick, simple one is, can we still walk our dogs?
Can you still walk your dogs? Absolutely. Yes, I can absolutely go outside and walk your dogs. I think that's going to be good for you and good for the dog, and we don't want that stuff in the house anyway, right?
Are the people needing food from the food bank?
I wish I meant dog poop.
Are the people needing food from the food bank being taken care of?
This is a great question. The question is, are the people needing food from the food bank being taken care of? And I have actually been having a lot of different meetings on this topic. The provision of food is going to be absolutely critical throughout the course of this pandemic. And unfortunately, our usual distribution models are not going to work in this situation, right? Normally, we have a centralized distribution system where everyone comes to the same place to get food. We have to actually turn that model inside out and start to think about delivery capacity. The good news is we've been doing some of this thinking ever since the October 2017 wildfires. During that, we actually saw local organizations step up and really help our community. Out in West County, Catherine Couch of Ceres did an amazing job delivering food all over the county to different shelters. And so we actually went through a request for proposals process at the county to make sure that the next time that we had a disaster, we could actually reimburse those folks who were doing that food delivery service. So we currently have 4 food providers on contract with the County of Sonoma, including Ceres. And what we're doing right now is we're trying to figure out, first of all, how do we get information about who needs food? And then how do we make sure we have adequate delivery capacity? One of the challenges that we're seeing with a lot of our nonprofit service providers is that many of the volunteers who have helped to deliver those meals are seniors, and so they are being asked to self-isolate at home. So we're trying to figure out how we can stand up additional capacity, and one of the conversations that's happening is we do have some county workers who cannot perform their current jobs because they're customer facing, right? Eligibility workers, things like that. And so we might be able to get them, as well as other younger volunteers, to come help deliver meals. So that is an absolute top priority, ensuring that we've got a good food supply, and importantly, that we're taking care of the most vulnerable residents of our community who need that food, whether they are unsheltered or whether they are seniors who are medically fragile, who need to be staying in their own home. We are going to make sure that we have a food delivery system that works. So, next question.
Is there progress on getting adequate protection for nurses, and also where are we on getting more testing?
This is a great question. So the question was, where are we on getting more PPE, personal protective equipment for nurses, and also where are we in getting more tests? So number one, I announced this early on, but I don't think a lot of people had joined yet, is we've actually just gotten a donation from Keysight of PPE that's supposed to be delivered to our Emergency Operations Center tomorrow. So huge shout out and thank you to them. Number two, we are going to be getting additional PPE from the state next week. That PPE is going to be really geared for homeless service providers. We are also working to try to order PPE through the Emergency Operations Center, recognizing that that is going to be a critical need. I just cannot emphasize enough how important it is to keep our nurses and our doctors safe and healthy so that they can take care of the rest of the community. So we will do whatever we can in county government in order to make sure that we have adequate supplies of PPE. We're working very hard on that. Second question was testing. Oddly enough, the limiting factor right now with the tests, we're experiencing a nationwide shortage of swabs. So the actual little thing that you utilize, to get the sample, that is in short supply nationwide. The other shortage that is currently also a nationwide shortage is the reagent. So even though we actually have adequate testing kits, there are some key components that are needed to move that sample forward that are in short supply across the country. And so we are continuing to advocate. We're reaching out to our federal legislators. I actually had a phone conversation yesterday and today with Congressman Mike Thompson's office, and I know this is on his radar, and he is advocating to try to get us what we need here in Sonoma County. Next question.
Are any child care centers open or going to be open with this new order?
This is a great question. Are any child care centers going to be open with this new order? Again, we just got a copy of the order this evening, so we're going to be reviewing. There are a number of, it's actually based on federal guidelines, so we're going to be comparing those federal guidelines to what our existing order is and then seeing what we need to adjust and how we can inform people. I will let you know that we are having conversations about how to provide childcare for healthcare workers because we have a lot of healthcare workers, physicians, nurses, physician's assistants who are staying home to take care of their children who are out of school right now. So we are actually actively working through the Emergency Operations Center on trying to find safe ways. So in other words, small groups, childcare of appropriate, ages, and trying to follow the best practices of the protocol, but so that we can get those healthcare workers to be able to work at our local hospitals and clinics. Next question.
Do you know if it's okay to go to the beach?
Do I know if it's okay to go to the beach? Oh, this is a tough one because under our health order, it was okay to go to the beach and it was okay to go to any of the regional parks. That is something where I will absolutely look into that and get back to you because I do not know if that is allowed under the current statewide order that comes into effect tonight. So great question, and I will make sure that that makes it onto the FAQs on the county website, and I will also post that online to my social media page to try to keep you informed.
Do you have any specific recommendations on how people can volunteer to help seniors or other people?
This is a great question. So a question about volunteering to help seniors and help other members of our community. I have a number of organizations that I know are working in this space, but it feels like maybe we need to get some kind of a warehouse so that everyone can kind of go to the same portal for signing up for volunteering and bringing all of those service providers together. Right now, the one that comes to mind is Ceres because I was just talking to them earlier today, but I'm sure that there are many organizations who are working on this, and I will also write that one down and get back to you and make sure that we can find a good place for people to be able to sign up to help our seniors.
Suggest the volunteer center.
Yeah. Oh, and actually my husband has a good idea, which is we do have the volunteer center in Sonoma County. And so that might be one way. And actually 211 sometimes plays a role as well. 211 is usually what you want to call if you need help, but they might also be able to provide referral services to nonprofit organizations that are seeking help.
Are the winter shelters going to remain open in Guerneville?
This is a great question. So are the winter shelters going to be remaining open in Guerneville? At this point in time, I have not heard of any plans to extend the winter shelter in Guerneville. But what we are trying to work on is actually, the problem is that shelter models are actually not really how we want to take care of our unsheltered population right now, right? Because sheltered models, that includes having a lot of people often in one room, often in close proximity. And so what we're trying to do is we're trying to stand up other models, including these trailers that we got from the state of California, including leasing motel rooms so that people have their own space. So at this point, there are no plans to extend the Guerneville shelter. And what we're trying to do is trying to move beyond shelter models to get people into some place that is safer and less communal, where it's less likely to see disease spread.
Have someone asking the question again if locations of positive test results can be given out.
We got a question that I think I answered yesterday as well, which is, can the locations of positive test results be given out? And unfortunately, the answer is no. I know this is really frustrating, and I'm a big believer in government transparency, but this is a case where it's really about protecting that doctor-patient confidentiality in that relationship and us complying with HIPAA. So I know that this is challenging. I know that this is frustrating, but I would also say that, at this point, the virus could be anywhere in our community. And so really your best thing that you should be doing is following shelter-in-place orders. And if you do need to go out, you should act as though, any surface that you could come into contact with could actually have coronavirus on it. And this is not to be paranoid, this is just to be safe, right? So you need to be washing your hands. You need to be utilizing hand sanitizer. You need to be wiping down those frequently used surfaces, because it would actually give you a false sense of security. Say, and this is not true, but say all 9 of the cases that we currently have in Sonoma County, I'll just say they're in Forestville because that's where I live, right? And this is totally not true. So this is just a hypothetical. But just because the cases were in one part of the community wouldn't mean that other parts of the community didn't also potentially have exposure to coronavirus, because even if someone tested positive in a certain place in the community, they would have traveled elsewhere. So even though people are frustrated by the lack of information, I think the best practice at this point in time, follow shelter-in-place orders, and when you go out, make sure that you are following protocol that essentially assumes that anywhere you go, there could be a virus. So,
can construction work continue?
Can construction work continue? So under our existing order, which is now going to be superseded by the state order, construction work was allowed to move forward. I'm going to check into that and get back to you with respect to the state order. We should have guidelines out as early as tomorrow, as County Council reviews this and sort of tries to see what constitutes an essential versus a non-essential business. So we will absolutely get that information out to you as soon as our attorneys have an opportunity to review the new governor's order.
Have any idea when the stores will get more hand sanitizer, or
Oh,
what people can do about that?
That's a good question. When will the stores get more hand sanitizer? I do not have any answer to that one, but I will say, that even some of the small stores in Sonoma County, little neighborhood stores in rural areas, had hand sanitizer and wipes and bleach and things longer than some of the more centralized stores. So that might be a place to look. I would also add that, distilled rubbing alcohol is a hand sanitizer, and you can actually put that into a spray bottle and spray it, as long as you make sure that it's a high enough percentage. So I think that it has to be at least 62 or 68%. Double check that. But that can be used in a pinch. And good old soap and water is the best thing that you can do, because actually soap breaks down the virus pretty effectively.
Can you briefly summarize the difference between the local and state order, if you are familiar enough yet?
Yeah. So can I briefly summarize the difference between the local order and the state order? Well, I'll start off by saying that, our local order was about 8 pages and actually offered pretty detailed guidance as to what constituted an essential business and what constituted a non-essential business. There were still a few types of businesses that were a little unclear or fell through the cracks, or people had questions, but it was fairly detailed with respect to what you could and couldn't do. The state order is 2 pages. It's much more simple and straightforward, and it actually refers to a federal list of what is considered essential activities. And some of those essential activities aren't quite as relevant locally. And so, there's things like chemical manufacturing and a variety of different industries that we don't really have a lot of in Sonoma County. So we're still looking into exactly how that order is different, and I can promise you that we will follow up and get back to you tomorrow on that one.
Do you know anything about agriculture under the governor's order?
I did see that agriculture and food production is still considered an essential activity, and as well as being able to go to the grocery store, being able to obtain medical supplies, being able to go to the doctor. So those things are all listed as essential activities under the governor's order.
Other than short-term empty shelves, is there any concern about real disruptions in the food supply?
So we have actually been working in the Emergency Operations Center on sort of looking into issues of food supply disruption, and we're actually so that's just, I want you to know that is something that we are actively monitoring and looking into, and there is no discussion at this point in time of seeing significant disruptions to the food supply. Right now what we're just seeing is a shortage because everyone went and stocked up all at once. And so, it takes the system sort of a while to then rebalance after that. So what we really saw was a local spike in demand, not an actual dip in supply over the past week or two. So I think that that will level out once, I think that a lot of people have very full pantries and refrigerators right now, and they'll be working through that in the next couple of weeks. I will also add that we are very lucky in Sonoma County in that we do still have local food production right here. We have farms who are still delivering community-supported agriculture baskets. We have farmers markets that are still providing food for people. And we also actually have fishermen who are fishing just off the coast in Bodega Bay, and they are still bringing in fish into the harbor. So we have a lot of opportunities for local food, and I think that that makes us more resilient than some municipal or highly urbanized areas that don't produce as much of their own food. I mean, think about, over the summer, the number of fruit trees and the amount of sharing of food that happens just between backyards. So we're very lucky, and I feel confident about our food supply in Sonoma County. And I see that actually Jennifer Branham Burns with Laguna Farm is saying she's got to go back to work because agriculture never stops. So there you go. We've got farmers who are working hard to make sure that we're kept fed here in Sonoma County.
Questions on both wine and wineries and cannabis and whether they're allowed to continue.
That is a great question. So the question was, are wineries and cannabis allowed to continue with the new governor's order? And again, that's something that I'm going to have to look into and get back to you on. So they're also into the governor's order, there were opportunities to create exemptions for other sort of types of businesses that were not cataloged in the federal list. And so we're not really sure what exemptions, if any, Governor Newsom might consider. So any other questions?
Is there a list somewhere of essential businesses that people can refer to?
Yeah, so if you go to, I actually posted on my Facebook page the actual copy of the order, and there's also actually a link to the order. When you go to the order, it has a little website link to the federal website that then includes this, I think it's 16 perhaps, different essential categories that they have there.
Do you want to give out that phone number again for...
Yeah, that's actually a good idea. So one more time, I'm going to give out the phone number, which is 707-565-4667. Again, that's 565-4667. And if you press 2 for small business assistance, that is a number that can answer questions about the coronavirus. So that will help you if you are a small business owner trying to come into compliance with a new state order. They will be able to provide you with information or get back to you via email to follow up and answer your question.
Do we know if the virus can attach to food, for example, at a farmer's market?
Do we know if the virus can attach to food? That is an excellent question, and I was actually discussing this a little bit with my own family doctor earlier today, and it can live on surfaces, so that would include food surfaces, right? And if you look, there are different lengths of time for different surfaces, depending, I think, on the porosity of the surface, and various other factors. So the virus can live on surfaces, and that is one of the big concerns. And that is actually, I think, one of the ways that it winds up being transmitted in the community. When I speak with the public health officer, you can touch a surface, right? And then you touch your face, and then you can actually get infected with the virus that way. That is sort of one method of transmission. The other, of course, is through respiratory droplets, sort of breathing in after someone coughs or sneezes.
What remote job opportunities do you foresee for those of us who lost jobs overnight? I was self-employed contractor at public schools.
So this is a great question and a really hard question of what kinds of job opportunities can we think of for people who unfortunately have lost their jobs. There are a few things that I am working on here locally. One, I know that the restaurant industry has been very, very hard hit from this. As people shift to takeout only, I've heard of a lot of layoffs of workers and cooks. They're basically having to shrink their workforce down. So one thing is that if we have a need to deliver food to seniors who are self-isolating at home, it's possible that we could actually utilize some of those folks to then cook in commercial kitchens, and then we can deliver food to people at home. So that's one job opportunity. It's very challenging, I think, for folks who are self-employed right now, and that is something that I have talked to Congressman Mike Thompson about. I actually was on the phone with his chief of staff locally, Stephen Gale, earlier today discussing the need for assistance for our self-employed folks. Unfortunately, a lot of the federal packages right now are really focused on traditional workforce, so people who are working for an employer and then they can file an unemployment claim. There also are conversations happening at the federal level about paid family leave for those who have children and have to stay home in order to take care of their children who are out of school. Although now we're all staying home, whether or not our children are out of school. So I don't have any immediate answers for people who are self-employed, but please know that it's a top of mind concern and one that I am working with, making sure hopefully that we can raise that issue up and we can try to get some help at the federal level and make sure that, that self-employed folks are not forgotten when it comes to these aid packages. Looks like I've got another question. Are there effective ways to clean fresh food to remove the virus? That is an excellent question. I mean, when it comes to removing the virus on regular surfaces, soap and water and rubbing alcohol are two effective ways of sanitizing things. So if it's the kind of food where you can actually just wash it with soap and water, that would be an effective way of washing the virus. You might hear some whispers in the background. We have some truants over here who are supposed to be in bed and keep coming out. So we had a little interruption to the question asking.
Is there any list of places where people can get tested?
Is there any list of places where people can get tested? This is something where you have to go through your physician. So you have to go through your doctor's office. It's not something where you can just drive up to a drive-through testing location. All referrals must go through your medical provider. So please contact your doctor, your primary care physician, and actually the best way to do that right now is by phone. So don't try to show up at your doctor's office. Give them a call. A lot of the different healthcare providers in Sonoma County are utilizing telemedicine right now. So they're asking you about your symptoms, they're asking you about your history. They're doing a lot of things over the phone, and that is really critical when it comes to mitigating the spread of the virus.
As a restaurant, do you foresee any more restrictions forthcoming?
That's an excellent question. As a restaurant, do you see any more restrictions forthcoming? Excuse me. I think that that honestly the most restrictive sort of set of guidelines is probably already in place. Food provision will remain a critical function. We have to make sure that people have food to eat, and restaurants are a critical way of ensuring that happens. So I think that the sort of takeout delivery model, I would anticipate that continuing because that is an essential critical function for our society and for our community. And I think that my hope is that we can really mobilize our local restaurant community to help provide that food so that hopefully we, for instance, we could have a new restaurant voucher system and we could give out vouchers to local folks who, are hungry and need food and they're, stuck at home, so they're experiencing loss of income, and then they can utilize that to then go and get either delivery service or they can go get some takeout from a local restaurant, and that will keep our economy going and keep people fed at the same time. I see a question of how many COVID patients do we have in the county right now, and we have 9 active cases. And that 9 active cases, to compare that to, we have had 196 tests administered in Sonoma County. Obviously, we would love to see much more widespread testing, but as I mentioned earlier, we are experiencing shortages of both swabs as well as reagent. So
we had a few different questions basically asking, do we have any idea how long this is all going to last?
That's an excellent question. So folks are wondering how long this is going to last. The word from the state is that we are not expecting most students to return to school this year, and so we don't know. You can sort of look at what the trajectories of other countries have been. We're finally starting to see, which is very, very hopeful and exciting, no new cases out of China. So that kind of gives you a sense of how long it took them to overcome it. They also did take very aggressive measures, and I think that one of the things that is good about this statewide action is that California is stepping up and taking aggressive measures to combat and fight the spread of this disease. Looks like I've got a friend over here this is my truant, Addie, who is supposed to be in bed right now, and this is the other troublemaker over here, Gillian, who is supposed to be in bed right now. So this is actually a really good question. I see this just came in. Do you know how long it takes to get results from the test now? So our public health department is actually returning tests same day, and actually sometimes in a matter of hours. If you get a test in for the last batch of the day, it could actually just be a few hours before the test result is returned. I have heard that the private health labs are taking a little bit longer. So this is one of the rare instances in which government is actually faster than the private sector. I'm not sure why that is or what is different about their testing parameters, but I do know that our tests are being returned results pretty rapidly. So, all right. Any last questions before I get these troublemakers back off to bed?
You mentioned that dashboard earlier.
Oh, yeah. One last thing, good recommendation from the husband is I want to recommend going to socoemergency.org and clicking on Story Map. And that gives you real-time information. It's got a whole dashboard. It not only provides you with the number of cases that are currently active in Sonoma County, the number of tests administered, the number of people recovered, but it also shows you the data from the surrounding counties. So that can kind of help you, sort of see what's happening, not just in Sonoma County, but also in our neighboring counties. So, all right. Have a great night. We're on day 2 of this shelter in place. We're in this together. I know we can get through this. We have a strong community. We have a lot of great farmers who are growing wonderful food for us. And take care of yourselves. Be well. Treat this seriously. But we're persistent here in Sonoma County, so we'll keep persisting. Take care, everybody.